Thank you very much, Mr. Chairman, and congratulations. Dr. Lynch, thank you for being here today. HRSA's report details many instances where the neurological condition of patients were not thoroughly assessed. Can you provide a few examples of where you found that to be the case?
The initial one was what we are calling the index case. That individual was showing increased signs of consciousness over the day preceding the organ recovery attempt and then throughout that day of the organ recovery attempt. Despite the OPO noting this in its own electronic medical record, they continued without deviation from the plan and went to the operating room with the intent of recovering his organs.
What changes to policy or procedures would you or have you recommended to ensure that patients are thoroughly evaluated prior to moving forward with procurement through DCD?
So for DCD to be done in a safe way, for any potential organ donor to be evaluated in a safe way, we need to understand what is wrong with them and to what degree there is chemical manipulation of their neurologic status, by which I mean, is this what we're seeing on a neurologic exam brain function, or is it brain function and being sedated or paralyzed in order to accomplish other medical tasks?
Thank you. Dr. Lynch, could you briefly describe what leads to variations in process and procedures related to DCD in hospitals and OPOs?
So again, the hospital providers have a role in this, but they are dependent on the OPO as their subject matter expert. OPOs have had established areas of care for many years. They have a responsibility to provide procurement care in every hospital in their area, and so they all have hospital development divisions that are supposed to go out and provide education. That education can be in the abstract. A provider may not see somebody who could be an organ donor for many months. When a potential donor is identified by the OPO, they need to provide updated information and what we would term just-in-time training to make sure that there's a good expectation of the respective roles and the ability to reassess if this is a potential organ donor if the neurologic status changes.
Thank you, and I'll follow up with that. You've answered some of that. How might this lead to different standards in patient care and occasionally patient outcomes in CDC cases?
So this is meant to provide consistent care to make sure that the imaginary lines or the invisible lines over which a patient may move within a state or across states don't affect the quality of neurologic care that they will receive in a hospital. And that they are able to have equal access to being an organ donor if that is the path for them, or to not being subject to that procurement process if it's not appropriate.
Thank you. Dr. Lynch, has HRSA ever recommended that an OPO be decertified?
So the decision to decertify an OPO actually rests with CMS, not with HRSA.
Thank you. Has an OPO ever been decertified?
No.
Thank you. Mr. Chairman, I yield back my remaining time.
The gentleman yields. The chair recognizes the gentlelady from Colorado.